When a patient is missing a tooth or teeth, the jawbone around that area will reduce in size. When this occurs, the area that the tooth or teeth used to be located no longer supports a tooth the way it once did. In circumstances like this, patients typically are not candidates for dental implants without increasing the amount of bone in the area. Oral and maxillofacial surgeons now have the capability of growing bone in areas such as these so that it may be once again suitable for dental implants. This gives the patient the ability to restore their natural look and feel inside their mouth without having serious complications down the road.
When somebody has a tooth taken out and they're getting it ready to place an implant down the line, when a tooth comes out, what we need is for that socket to heal in a tabletop fashion. I want it to heal like a table. As long as there's good bone surrounding that tooth, when the tooth comes out, it'll do that on its own. And you don't have to do any fancy permutations to make it do anything other than that. It will heal on its own and form a nice tabletop. If there's not a lot of good bone surrounding that tooth, what will happen is over the course of time it takes for it to fill in with bone, that ridge can form a knife edge or a ridge. That becomes pretty complicated to place an implant at that point because you've lost your tabletop. So sometimes when a tooth comes out and we look at the socket and it doesn't look like it's going to heal in a tabletop fashion, we talk about doing something called a socket preservation. And what a socket preservation is essentially a small bone graft using some, bottled bone. And that bottled bone used to be cadaver bone. You just can't really call it that anymore. It's been treated in so many ways that it kind of just minerals. It tricks your body into forming its own bone. But what that does is it plumps out that ridge and allows that ridge to heal in a tabletop fashion. As long as it heals in a tabletop fashion, it's a pretty simple matter to place that implant. Not everybody needs that socket preservation when a tooth comes out, and I'm not a used car salesman. If you don't need it, we're not going to do it, but there's a pretty good chance you'd need it.
In some situations, bone may need to be harvested from the patient's own bone. However, there are now many situations in which synthetic bone can be used. Depending on the situation, surgery may be performed in the office or at a hospital. Regardless of where the surgery is performed, it is often a day surgery procedure.
The biggest reason a socket preservation is done is to get an area ready for an implant down the line. And typically, after the socket preservation is done, you'd want to start looking at it at about 3 to 4 months out. And the reason is because it takes that amount of time for the bone to heal in a fashion that's dense enough that an implant can be placed.